Hey guys, today I'll be talking to you about the growing rates of stroke in China. So, stroke is actually one of the many non communicable diseases and is currently the second leading cause of death worldwide. So much so that it affects more than 17 million people annually, and more than one third of strokes are fatal. So, there are two types of stroke. We have ischemic and hemorrhagic. Ischemic is actually the most common type of stroke, and this happens when the blood clots block blood vessels into the brain. And hemorrhagic strokes are when an artery in the brain leaks blood or ruptures. Then the leaked blood slowly puts too much pressure on the brain cells and damages them. Then you have TIA, or transient ischemic attacks. This isn't necessarily considered a stroke, but it is classified as like a warning stroke. This is caused when there's a temporary blockage of blood flow to the brain, but it only lasts about 5 minutes because the blood or the body naturally dissolves this clot. But it is still important to seek medical attention to prevent a major stroke down the line. Some symptoms include speaking and understanding what others are saying, speaking and understanding what others are saying. So you'll notice that someone who is having signs of stroke, they'll often start slurring their words. They're more confused. If you're having a conversation with them, they'll stop making sense in what they're saying. They'll experience numbness, weakness, or paralysis in the face, arms, and legs. This often just affects one side of the body, but it comes with trouble walking, coordination, um, just not being able to hold yourself up upright. Then they have problems of seeing in one or both eyes, and this is usually you'll usually see this because they have a sudden blurry vision or a blackened vision, and it can go from blurry to blackened very quickly. So there are quite a few risk factors, but this is the top five that I found. So high blood pressure, smoking, diabetes, high cholesterol, and obesity. I will only be going into detail with the first three. So high blood pressure is when the blood flows with too much pressure, um, and then putting a lot of force on the arteries. And if this is left uncontrolled, then this causes damage to the arteries over time, and this damage can then lead to blockage and blood clots that limit blood supply to the brain. So smoking also increases blood pressure, and I just explained why that's bad. But it also does something called making the blood sticky, and if the blood is stickier, then it's more likely to clot. Smoking also narrows and hardens the arteries, and this condition is called atherosclerosis. So when the arteries become narrow and less flexible, it reduces the blood flow, raises blood pressure, and increases the likelihood of blood clots. So for having diabetes is a risk factor for strokes because when we consume food, our body processes that glucose, our pancreas makes the insulin, but those with diabetes either don't produce enough insulin or produce no insulin at all. But if left untreated, diabetic patients over time have excessive blood glucose, and that can cause fatty deposits, which then turn into blood clots, which then, you know, cause strokes. So how does this lead into China and strokes? So China has had an increasing trend of mortality rates related to stroke, so much so that in 2011, the Chinese government launched a stroke prevention project committee. And the committee's aim is to reduce the risk of strokes by improving awareness, control rates of stroke risk factors among Chinese residents. So they did this by using publicity and education, screening and physical examination, and then risk classification judgment based off of the screening, and proceeding to provide comprehensive interventions for those who are 40 and above and are seen as high risk. So, a couple years went by, and the Chinese government saw that this committee was not really as effective as they needed it to be. So in 2016, they came up with something called Stroke 120, which primarily focused on publicity and social media as a way to spread awareness. The government collaborated with hospitals, medical professionals, and even social media. So, for example, a website called WeChat, which is our version of like Instagram, And they did all this to create posters, cartoons, lectures, short 1 minute advertisement videos for people of all age groups. And the best part was that they translated all of this into 22 dialects. So they really wanted to make sure that everyone had access to this information. And it was so critical. It's so critical to deliver um, the message of being able to recognize signs of strokes, because the faster a patient who's having a stroke can get medical attention, then they are more likely to, one, stay alive, and two, be able to get back to life as normal. 2 years down the line in 2018, I'm not sure if it was the government or another group in China did a study to see whether or not people felt like the Stroke 120 campaign was making a difference. So they asked questions such as, do you feel like you know how to provide help for someone having a stroke? Do you know how to recognize it? And there was an increase, or there was a huge change within the urban populations, but not so much the rural. And I'm assuming that this is because rural provinces don't have as much access to the internet. And I'm assuming they didn't put as much of this campaigning in those areas, um, which makes me believe that in order for strokes in China to the rates of strokes to be lowered, there needs to be more of a target towards these rural populations, because we see most stroke prevalence in those areas as well. So, as mentioned, health is overall better in more industrialized provinces than rural. Compared to urban participants, rural participants had a higher proportion of people with only a high school education or even lower, and they were overall had lower income levels. They also had a higher prevalence of smoking, drinking, physical inactivity, and obesity. And I think this all ties in very well, because lower income, they don't have as much access to education, and if they do have access to education, it's only for so much, because they have to go into the workforce at an earlier age and do a lot of manual labor. So I don't think those living in rural areas are really thinking about, what's best for my health in a way, which is why we have such a increase rate of smoking, drinking, and obesity in those areas specifically. So in 2018, the economic burden of stroke in China included a direct cost of about 248 billion yen and an indirect cost of about 704 billion yen. So direct costs are attributed to things such as medical aid for those who have strokes, medications, staffing, but also all of the advertisements and the committee, the 120 campaign, all of that is tied into the direct costs. Whereas indirect cost, as I mentioned here, is the majority of that came from loss of productivity as a result of premature mortality or work absence. And this, as you'll see in the next slide, is because in 2019, some data showed that 3.9 million there were 3.9 million new stroke cases, but 2.2 of those people died. Of the people that survived, over half of them claimed, or not claimed, were shown to have experienced cognitive or physical impairments. So when you have those impairments, um, you're less likely to go back to work. You're probably less likely to be rehired, or even if you try, it'll be harder for you to to assimilate as you did before. So that then leads into a lack of generating, money and funds for the government, for the economy. Um, and then it showed, all the research that I did showed that there was a higher rate of mortality within for men um, that experience strokes than for women. But all of the risk factors for both men and women were essentially the same, with the only difference being smoking was a higher risk factor for men than for women, because women had higher BMI issues. Cultural consumption. There was an cultural characteristics. There was an increase of consumption of red meat, and nothing that I researched explained why. But there was a theory that it's because in urban areas, there's been a slight increase in the income of most families, so they're able to afford to eat like things such as beef, which is more luxury of a meat. There's decreased levels of activity globally, but specifically for China, it was um, thought that part of the reason is due to China's pollution issues. So, because the air is so heavily polluted just on a natural basis, on an everyday basis, people aren't really going outside walking as much um, as they maybe were in the past. And then lastly, you have an aging population. So strokes do occur in, are more prevalent in the age ranges of 60 and above. And China has a huge age gap. Um, we've talked about in class. So it's like there's a lot of older people and there's a lot of younger people, but not really that in between. So as that population ages, we are going to continue to see a growth of growing rates of strokes unless we find a way to really stop the or prevent the risk factors from being as much of a risk. So for treatment, back to what I was saying, you really have to make sure that people are living a healthy diet and getting um, exercise, lots of exercise. And if someone does have issues of high cholesterol, high blood pressure, is diabetic, they have to make sure to get that in control. But also smoking. Smoking is very, very prevalent in China, especially among men. But to really reduce all of these risks, that has to be cut down, or even, you know, best would be to stop smoking in general. For those who have experienced the ischemic strokes, something that has been used in the past is something called TPA, tissue plasminogen activators. One example of that is the thrombolytic. But the only caveat to this is this can only be applied to patients had who've had their strokes within 3 hour mark. And the thrombolytic is, I guess, a blood thinner in a way. It breaks down blood clots. So this is why it's so important to get these patients to have medical attention as soon as possible, because after that 3 hour mark, your rate of survival is decreased. And then not only that, but if you do survive, the likelihood that you're going to be as functioning as you were before is also decreased. But lastly, for the hemorrhagic strokes, because they're ruptures, surgery can be used to repair these ruptures. But even with all of the treatments, um, physical therapy and just therapy in general is heavily recommended for anyone who's experienced strokes. Yeah, that's it. I look forward to your questions in class. And here are all my resources. Thank you. Bye.